Hello guys, welcome to the Concepts of Medical, and today we're gonna start a series of lectures about the language of anatomy. And so this is the first video in that series. So this is all about and the position. So what are the main position used in the anatomy? So the first position here we have is the anatomical position or anatomical position. It is what is it, right? When a person is standing straight with eyes looking forward, both arm by side of blood, palms spacing forward, both feet together, the position is called anatomical position. It says that when a person is just standing in erect position and his both palm are just like this by the side of the body, and it's facing forward, and also his eyes are looking to the forward, so this position is called anatomical position. You can also see this position in the picture as well. So this is the anatomical position. Usually when we describe every relation or anything in anatomy, so we describe all of them in anatomical position, right? So here we have the second one position, which is supine position. So when a person is lying on her or his back, arm by the side, palms facing upward and feet put together, the position is supine position. So this is the same condition like the anatomical position, but in this condition the patient is just lying down on the floor or on the bench or everywhere. So this is the same position where the palm of the hand is facing upward, and legs are both together, and the face is also face, chest and abdomen is also facing upward. So this position is called supine position, right? You can also see this in the picture, that this is the supine position, and this position is mostly used for radiological purposes and for the x-rays and all these purposes, or for diagnosis of the patient, for the heartbeat and for everything. So this is the position of anatomy which is called supine position. Here we have the third one, which is the prone position. Person lying on his or her face, chest and abdomen to the downward. So in this position, this is the same condition like anatomical position, but here the person is just lying down and his face, chest and abdomen is facing downward, and his palm is facing downward. So this is the third position, which is called the prone. You guys should be very clear about all these positions because they are very important in anatomy, and mostly MCQs are just picking from there and just confuse the students, right? So you guys should be very clear about all these positions. You can also see this in the picture. This is the prone position. The person is just lying down, and all the palm and the chest, face, everything is just facing downward. Here we have the fourth one position, which is the lithotomy position. Person lying on her back with legs up and feet support and strafe. This position is mostly used during the delivery of the baby. So this is the another position, but this position is mostly taken by the female body, because in this position the legs are slightly off by the body and it's just supported by a strap, and this position is mostly used during the delivery of the baby. You can also see this in the picture. So this is used in the delivery of the baby, and this is mostly this position is mostly used for the female, right? So this is the here is the another position, which is the Fowler's position. A Fowler position is a standard patient position in which the patient is seated in a semi-sitting position and may have knee either bent or straight. So this is the position in which the patient neither sit nor just lie down, but semi-sitting, and his knee are neither bent fully or neither straight fully, but sometime it would be either bent or straight. And this position, you can also see this in the picture, and this is mostly used to feed the patient and also for the radiological purposes. So this is the Fowler's position. Here the another one is Trendelenburg position. Trendelenburg is which type of position? In the Trendelenburg position, the body is laid supine or flat on the back on a 15 to 30 degree incline with the feet elevated above the head. In this position, the body of the patient is just in the supine position. Here we discussed, but here the feet is just elevated above the head, and it make 15 to 30 degree with the ground. His feet with the ground just make 15 to 30 angle, right? So this is and this is also the Trendelenburg position. This is mostly used to control the blood pressure and regulate the blood pressure. You can see it in the picture, and also it is used to when the patient just get fainted. So we are with when some drugs or injection just overreact on the patient, so we just put the patient in the Trendelenburg position. Here we have another position which is right lateral recumbent position. The word lateral means to the side, while recumbent means lying down. In the right lateral recumbent position, the individual is lying on the right side. So this is the another type of position in which the individual is just lying down on the lateral side, and it he just bent to the right side, and his one arm is below his head and another arm is above his thigh. So this is the right recumbent position, and this is you can see this in the picture, and this is used to access the left side of the patient for the doctor. This is the left lateral recumbent position. This is the same position like this, but here the patient is just turning to the left side, and this is mostly used to the for the aspiration. You know what is aspiration? Aspiration is to getting the content from the stomach to the lungs or another organs to the lateral side. And it is also used to facilitate the vagina. So this was all about the positions, basic positions in anatomy. So in next video we will discuss the relations of our body to each and every organs. So this is, if you want these hands out and these notes in picture, so you can go and visit my Facebook page. The link is in the description, so you can easily get it from there.